Well, then there is this mid-level personality, and we talk about personality disorders, personality syndromes. They are not organic matters. They do not really affect your actual skills or your motor expressions or anything like that, and they are not illness. It's not like you become infected with borderline personality disorder. They do develop throughout childhood and adolescence, more or less, and they become woven into your very personality, to keep it simple, your way of relating to the world, which again is something different from being actually perceptive or cognitive. It's more how you arrange your life, how your moral codes and your way of relating to other humans and all that stuff. And I would say that these are the least objectively observable, because a person having this kind of syndrome may actually be very much normal. You may have excellent communicative and social skills. You may have a perfectly functioning life, at least technically speaking. And nothing on a practical level is wrong or malfunctioning, and actually she may also feel, well, this doesn't necessarily have anything to do with your well-being, other than that they affect the basic conditions, your definitions about pleasure and satisfaction and all that kind of stuff. So what I'm trying to say is that in social interaction you might not observe anything different from anyone else. If you try to draw some conclusions, or you might want to make a map of some possible disorder or syndrome, you should instead look upon the patterns, her life on a general level, family structure, how what does her social network look like, if looking at her professional life, it's not so much about being more or less productive. It's more, how does he cooperate with others? What's her social role? And like those neuropsychiatric conditions, these are not in the matters that you recover from. There's no medication that will make these things go away. So this, along with the fact that this group of people are not necessarily suffering, there's nothing saying that they necessarily have any contacts and interactions with mental health care. However, if it does become a problem, that you might feel something is wrong, something can't get things to working, and this affects me, there's something that makes me feel limited, then you might perhaps apply for mental health care, and an actual diagnosis might be set. But still, it's not about actually recovering, it's about getting ways of dealing with it, finding techniques, some things you might actually need to accept that you need to avoid, because otherwise things will crash in some way. Some other things perhaps you will need to cut down on to some degree, or in some levels, some areas of life, it might only be a matter of finding ways of dealing with it, getting somewhat more neutral perspective to yourself, becoming aware of how other people may be more or less different from yourself without necessarily being wrong. I might perhaps add that even though considered chronic, they usually fade out somewhere in midlife. Some people say that it's connected to reproductive drives, and levels of hormone decreasing, and things become perhaps a bit less not so much black and white, not so much life and death. Should perhaps also add, and this is just a personal reflection, those features fading out seems to be very much the situation when the person in case has lived a hard life, been into drugs or criminal activities or mental health problems, then it's like they consumes all that power. They burn out rather than they fade away. And they, as far as I know, usually slow down and becomes, they seem more harmonic when they reach that age. And there is lust for substances may also decrease to some degree. But probably most people in this category are not like this. They have more average lives, and I have met quite a few of these, and I would say that they seem to develop in a very different way, and I'll return.